shortly the responsibility of treating with particular patients or patients who have chronic hypertension or diabetes and would normally access those services through our health centers or public health centers. So the ministry is now officially launching the public-private partnership to manage the care of persons with comorbid conditions, including diabetes and chronic hypertension, who utilize the public health system. The goal is to reduce the number of persons who have to come into our clinics, thus helping to alleviate the demand on the public health system as we manage the existing challenge, but also importantly as we prepare for a possible surge in cases once we have community spread, which we anticipate. It means that those persons who have been identified as controlled patients will be now outsourced to private practitioners so that they can get their medication and any required care, thus neutralizing the crowding effect that would normally take place in the health centers. The expression of interest is now launched, and those private practitioners who are interested should visit the ministry's website to indicate their interest, to determine what the criteria are, and I believe we will also take ads in the public media, in the newspapers, to provide further information. And I believe the information will be updated shortly, if not today, certainly by tonight. So that's our first public-private partnership, which we believe will assist in a meaningful way to manage those persons who are affected by those two ailments, and also hopefully enhance or minimize the risk once community spread takes place and persons who congregate would be more at risk. The second is an authorized field hospital, or of a field hospital in anticipation of community spread to support our treatment efforts. Yesterday, Cabinet approved the use of the National Indoor Stadium as a field hospital that can cater to up to 72 beds. This facility is a collaboration between the Ministry of Health and Wellness and the Ministry of Sports, Culture, Gender, and I think there may be one or two other titles, and Entertainment, Minister Babsy Grange. We have started the work to retrofit the facility, that is the National Indoor Stadium, which would complete, when completed, would have 72 beds, monitors, and other equipment. That work is being spearheaded by the Jamaica Defense Force. We're currently in the process of sensitizing staff, including on the subject of fit shifting if the need arises. The goal is to have only those who are mildly affected by COVID-19 be treated at that facility, and we anticipate that the facility will be up and ready in the coming weeks, in 2 to 3 weeks. It is to take a budget to complete this process of about $180 million, including the cost of personal protective equipment. We have been able to secure personal protective equipment, and this is an ongoing process to ensure that our frontline staff in the public health system can carry out their responsibilities in a way that reassures them of their own safety. We, however, in keeping with promoting the partnership with the private sector and private practitioners, we are happy to announce today that we are signing an MOU with the MAJ to provide 100,000 N95 masks to outfit our practitioners, or to support the preparedness and the work of our private practitioners. It is important for us that they remain active and that they see this attempt in the public sector to deal with this challenge as part of their challenge. And we are very encouraged by the leadership and by members who have expressed and continue to give support to these efforts. So we have decided to contribute, to encourage, and to partner with the Medical Association of Jamaica through the donation of these 100,000 N95 masks, and we will consummate that agreement in short order with a signing with the president who is here. In terms of I should also mention in regards to the M95 mask that we recognize that there is a supply shortage, and have therefore we have invested some 2.2 million US dollars to secure these masks. We just had some 500,000 arrive in the island recently, and it is from that supply that we're making a 100,000 donation, and we expect additional supplies to come. Another partnership that we are proud to announce today as part of the overall effort is the establishment and use of UWI final year medical students in our call centers to respond to the concerns that the public will raise around COVID-19. So today we wish to formally welcome some 80 medical students who are now manning the Ministry of Health and Wellness call center to the joint effort to beat the COVID-19 in Jamaica. Their addition to the team means that we are in a position to better respond to the needs of Jamaicans who will call in, have been calling in, and sometimes because of the numbers of calls each day, each hour, we do get a little backlog. I'm really pleased that the Medical School of the University of the West Indies is now partnering with us to do this, and again, in keeping with a show of working together, we will sign an MOU in short order to reflect that partnership going forward. And I want to thank the university and the medical school in particular, and the students who have volunteered, 80 of them, to be a part of the COVID-19 response. A further partnership that I am pleased to announce is one with Andrews Memorial Hospital. And so we are happy to announce that we now have a formal agreement with Andrews Memorial Hospital. The hospital will now serve as an overflow ward for the Kingston Public Hospital. That ward will host some 32 beds for the management of COVID-19 patients. Another ward has been reassigned to manage severe respiratory illness, SARI cases. This has reduced the bed capacity of the internal medicine department from 8 wards to 6. The additional beds at Andrews will be used for the management of non-COVID-19 medical patients, right? Non-COVID-19 medical patients who require inpatient care. And this will reduce the overcrowding on the medical wards at KPH. So again, another partnership which we will consummate in short order during these proceedings. Ladies and gentlemen, this represents the report for today in terms of the partnerships that we are consummating in strengthening the efforts to deal with the COVID-19 threat, the reports on the new cases, and progress report on those persons who came in the last few days, and our attempts at tracking those individuals in order to ensure that we assess their state of health to determine the extent of risks that they represent within the general population. At this time, we are going to now sign a number of MOUs to reflect the partnerships that I have just announced, and we're going to begin with Dr. Manning, who is president of the MAJ. I'm going to ask him to just come forward.
Too close.
You're not too close. Let me. Okay, thank you very much, Dr. Manning. At this time, I'm going to ask the University of the West Indies, represented by the principal, Professor Weber, and Ms. Dr. Donovan Stanberry, who is the registrar, to just sign the agreement on the university medical students who are
signing for this year, exactly.
Yeah, okay, so it's 1, 2, 3. All right. Okay, ready?
Manage,
All right.
tell them when to sign.
Thank you.
Thank you.
Yeah. Mm-hmm. All right.
Yeah, I'll sign after.
And the final signing representing our partnership is with the Andrews Memorial Hospital. And I'm going to ask Dr. Leash, CEO, to come forward and hi, please sit. How are you? No. You have your pen? Let's go straight to the.
Oh, you're going to sign a blank.
There's a blank page. Okay. Okay. Right. So thank you very much. So today we have signed 3 agreements which represents the strengthening of our partnership. That is the Ministry of Health and Wellness, Government of Jamaica, towards the COVID response, the University of the West Indies, and the 80 medical students, final year students, who will be manning our call center. The Andrews Memorial Hospital will now allow their facilities to be used as an extension of KPH to provide care to COVID patients, non-COVID patients, sorry. And then, of course, the Medical Association of Jamaica, Dr. Manning, and the donation of 100,000 N95 masks as part of the collaboration with the private entities. Beyond that, please see media if you're a private practitioner and interested in treating with our chronic hypertensive and diabetic patients as we move to the next phase of partnership, which is to outsource those services in order to better prepare the public health system to deal with some of the challenges that will come from COVID-19. At this time, I'm going to break and ask for any questions.
All right, thank you, Minister. We're reminding members of the media who are on Zoom that you can use the raised hand feature to ask questions to our panelists. I'm going to start with a question from Damian Mitchell from the Gleaner. He's asking, is there any plan for a field hospital in central Jamaica, which has been seen in increasing numbers, or western Jamaica?
At this time, we are using our present projections, and we have no finalized plans for one field hospital. As time goes by, we are evaluating to see what further may need to be done. So it is not an absolute no. I mean, as time goes by, things are changing, and so that may very well be on the desks soon.
Thanks, Amo. We're going to go to Althea Saunders.
Hello.
Let's go ahead, Althea.
Hi, good afternoon. Althea Saunders from the Jamaica Observer. Minister Tufton, I wanted to ask about a situation that happened last week, Thursday, where a cruise ship docked in Jamaican waters and there were 45 Jamaicans on board, crew members. They requested permission to disembark. The ministry has, well, as far as we know, according to what they have said, the ministry has not responded to that request. Well, they eventually left, but I wanted to know what was the reason behind the lack of response and if any exemption could have been made in a situation like that. I understand that our ports are closed to incoming passenger vessels.
Thank you. My information is that the Ministry of Foreign Affairs had dealt with the matter. The vessel, the personnel on the vessel were not allowed to land or did not land, and I don't have more information on that. I know that the Ministry of Foreign Affairs and Foreign Trade dealt with the issue, and I'd refer you to them to get better particulars.
Okay, thank you.
Thank you, Minister. We're going to go to Dion Jackson Miller.
Hi, hearing me?
Yes, we're hearing you, Dion.
Okay, great. Mr. Minister, as you are aware, several other Caribbean countries have gone the route of complete lockdown for various periods of time. And what is the Jamaican situation? Is there a particular trigger point you're waiting for? And if so, what is that?
Okay, thank you. We assess the situation on a daily basis, indeed multiple times of the day. The Honorable Prime Minister is briefed on an ongoing basis. The team provides the appropriate levels of analysis. The different ministries, agencies are very much involved. The Cabinet meets at least 2 times a week, and subsets of the Cabinet additionally so. And all with the objective of, one, managing the challenge in terms of assessing the extent of the risk, supporting the Ministry of Health in its public health efforts to contain and to treat and to prepare for, and at the same time trying to do so in an environment that allows some amount of activity to take place within the economy, within the society, beyond just the public health issues, in an effort to preserve critical activities. So whether it's essential services or services not legally defined as essential but critical to the existence of segments of the society. I know it's a long-winded way to give you a response, but the balancing of all of that makes a total lockdown a function of that assessment. And to date, we are still at the stage where we believe that balance can be managed in order to ensure that we get an optimal level of activity, even with the limitations that we have. Will there be a lockdown? It's a decision that the Cabinet, led by the Prime Minister, will make. He has said publicly that he prefers a gradual approach and an ongoing assessment of that risk. He does take advice from the public health experts, and it's going to be a function, I believe, that decision that is, of when we believe that it is necessary to have that full lockdown. Thank you.
Thank you very much, Minister. We're going to go to Brittany Clark.
All right. Good afternoon, Minister and panelists. Okay, so I have two quick questions. The first one, with the number of cases in Portland increasing and under investigation, are there any special plans for the parish? And what exactly is meant when these cases are said to be under investigation? And the second question, are you able to say at this time what the average rate of increase for COVID-19 cases in Jamaica is? And based on the day-to-day increase, is it in keeping with our projections?
Okay, I think the Chief Medical Officer will address those clinical questions, but I just want, before she comes in, to say it is a little concerning, the numbers under investigation. I mean, we're now at 11 of the 63 cases. And of course, the interpretation of that clearly is that, as I said, we're still investigating the origins of the virus. And it's not clear that you can trace it to an imported case, which is where it all started. And that therefore leads some margins of error and could possibly suggest additional spread that we're unaware of. And that then raises the issue of how much that may contribute to community spread, which is the next stage that we anticipate will come, having had the clustering of cases. I want to say to the public that, as has been said by the Prime Minister, by the Chief Medical Officer, and this PS and myself, we anticipate that there's going to be a surge. The extent of that surge is a function of how we manage, what information we have and can discern, and the process of containment and treatment. And very important in all of that is to get persons to be aware, to recognize their role, and to comply with the rules of engagement, whether it is to stay home, to report if they have issues, whether they feel ill or otherwise, or know someone who is the case. If all of us play that part, we could, I think, manage the process, even with the surge, that would keep us relatively close to normality while we treat the virus that is among us. But the under investigation does raise some concern, because it means there is more information that we need to find out. And that's a concern for us. But I'll turn over to CMO now to speak more to the clinical side of the challenge.
Right, thank you for your question. So just to explain a little bit, the 11 cases that we have under investigation, the 11 cases, it sounds large, but it actually belongs to 2 clusters. So we have a cluster of 6 persons for which we need to find the one person that has a link. We're investigating to find out where that link for the first case. So the first case was identified, and the 5 of their close contacts have been found to be infected. So that's one cluster. And the second is a cluster of 3 persons where the primary case was identified, and then the 2 close contacts have been affected. So though it seems large, it really is not 9 individual cases that have just popped up in the community, which would be a cause for greater concern. The additional 2 persons are what we really call high-risk professions, because what they are, one is a hotel worker, and so therefore the possibility of transmission from possibly an infected person within that environment could have led to this person being affected. And the other was a taxi driver who worked within that kind of tourism environment as well. So though it seemed like it's a larger number of persons, there really is an explanation, and it's not as 11 individual cases that we would not have been able to link would have been a greater cause for concern. Okay, so in terms of the trajectory, what we are still going along the doubling about every 8 days in terms of a number of cases that we're seeing. We're still traveling along that path, But I just want to caution the public, as the minister says, that it just takes one case, you know, for a lot of persons to be exposed to a highly infectious case for that to change dramatically. So we all have to be very cautious still.
Thanks, Amo. We're going to go to Zara.
Hi, good afternoon, everybody. Question for the CMO.
Just introduce yourself, Zara, please.
Pardon?
Introduce yourself, please.
Oh, Zara Burton. I'm with 18 Degrees North. Okay, CMO, couple questions, please. One is, the minister mentioned a moment ago that about 4,500 of the 5,400 people have now reported in that were in the island or came into the island between March 18th and I believe and 24th to 24th. The question I have is, how many of those people will be tested? How many have been tested? What is the protocol for testing those individuals? Is it different from the protocols you applied before? Overall, I'd love to know if your protocol has changed when tests started to now. Also, CARFA says each test was costing something like $250 a test. How much is the rapid test? So I'm asking you all of those questions for the Jamaican context. And lastly, I was speaking to an Eastern Caribbean contact yesterday who was using an epidemiologist in one island using rapid tests for one community where there was a diagnosed positive. And so they decided to test everybody in that community. As the cases increase in Clarendon, just wondering if you are going to be planning to test, for instance, everybody in Corn Peace.
Okay, thank you for the question. I'm trying to remember them all now, one by one. Okay, so let me start with the testing protocols and how they have changed. So initially, our testing protocols was aimed at testing suspected cases. So these cases would be persons who would have traveled to a country where there was transmission, or a person who would have been in contact with somebody who has been a confirmed case and now have developed fever and acute respiratory symptoms. That was in the initial stage when we had no cases, and every case would have been coming from outside. As time went by and we went into the phase where we now had imported cases, we now had to look at the contacts of those imported cases and also the possibility that there could have been any kind of undetected entry or undetected spread. So we have now widened our surveillance protocol and sampling of persons to include all the contacts, the close contacts of persons who have been confirmed to have COVID. And by close contacts, we mean that persons that live within the same household or would have had prolonged contact, say over 15 minutes with a person within a close space, for example, in a conveyance. And we also now include our community surveillance in that we have a network across the island, including our health centers and our hospitals. As you may know, we have over 300 health centers right across the island, and we have hospitals in every parish. And we do surveillance from these hospitals for respiratory symptoms. So all persons who present with severe acute respiratory symptoms and pneumonias, those persons are tested, whether or not there's any contact with someone who has had COVID or whether or not there has been any kind of travel. Also, persons that come into our accident and emergency departments and persons who come into our health centers who have influenza-like illnesses, that is fever and respiratory symptoms, we are doing sampling of these persons as well. For some health centers, the number of samples that we take from those health centers is really based on the number of cases that they do see, because some health centers do see small amount of cases, and so we would sample everybody that comes into that health center who has an influenza-like illness. While for the larger health centers that see many persons, we would be taking a sample of those each day. So from that wide sampling across the island, we would hope that to detect any kind of community spread that there is. In addition to that, we're doing our healthcare worker surveillance, where we are testing our healthcare workers who also may present with influenza-like illnesses, as well as our healthcare workers who may have been exposed. So healthcare workers who would have been exposed to someone who has had COVID, who think they have had an exposure and could become infected, a risk assessment is done for these persons and they are tested as well. So our healthcare workers still remain the highest likelihood of persons that could be have COVID because of their greater chance of infection, of exposure. So this is how we have our sampling method has changed over time. What we are most interested now in is to really to get all those samples in. So the testing protocol is meant to address the highest possibility of pickup, because these are the persons where we are going to get the highest yield of positive persons. So our aim now is really to get all of those persons sampled. In addressing the persons that have returned in the 18th to the 23rd period, we are taking a very systematic approach to these persons. Many of them are already have been in contact with their health departments, because those lists that were sent out from the airports to the individual parishes, the parish health department have been in contact with many of those persons, and some of those persons, based on the interview and the questions that were positive in terms of them having symptoms, were in fact sampled. I can offhand remember that we would have had at least two cases that would have been picked up through that kind of response to persons calling in when they have symptoms. For the balance of persons, many of who would have called in through the call center, we do recognize that there has been a little bit of a lag time in the follow-up of these persons, and we are trying to catch up on this by having doctors call these persons and then to categorize them into groups to see whether or not they need to be sampled. So essentially, if persons are having symptoms, or if they've had contact with persons, close contact with persons who would have been tested positive, yes, they would be sampled. So the directions, once we get those interviews done, the directions are being sent out to the health departments for the sampling to be done. And as I said, the health department has already been sampling some of those cases, and I can definitely tell you that we would have picked up 2 of our positive cases through that.
Thank you very much, Emma. We can go to Owen Brown. Owen? There's a question here from Debbie Ann Wright. She's asking, we've been told about the need to flatten the curve so that we do not overwhelm the health facilities. How many coronavirus cases requiring hospitalization does our health system have the capacity to deal with?
In planning for our response, we had to look at what numbers we would have been expecting, and we have put out in the public space already several times our projections. And based on those projections, we had made an allowance for 1 ward in each hospital to be reserved for COVID patients, accounting for about 380 beds across the island. This is in addition to the critical care spaces that we would have been resourcing over the last couple of weeks and continue to do so to try to get at least a minimum of 40 critical care spaces outside of what we normally have, that we would have been catering to the usual flow into ICU, HDU spaces. Now, in addition to that, so far, we are about, how many weeks now into the outbreak? About 8 weeks into the outbreak. 10 weeks? From March 10. 4 weeks. We're now 4 weeks into the outbreak. We have not yet we have not filled up those beds, and we have not had the demand to get for all of those beds to fill, although we recognize that in certain parishes are under a bigger strain than others, and we do have movement of persons out of parishes into the national quarantine facilities. And we have established other facilities outside of hospitals to house some of the more mildly ill persons who are confirmed cases. So outside of the hospital situation, we have established other facilities to take some of those persons. And then we are also planning in terms of the field hospital to give us an additional 72 beds. I must say that some of the larger hospitals are going beyond the preparation of that one ward. So the hospitals like the regional hospitals and the hospitals with heavy flow, those have gone beyond the planning for one ward and have gone to 2-3 wards that they are reserving for the management of COVID patients. So I would say in terms of flattening the curve, if it is that we do keep on this trajectory, then we will keep under that our health system's capacity. Again, I caution the public that it doesn't take much to push us out of that comfort zone. And so therefore we continue to plan and to identify other areas in which we can increase our capacity to deal with any eventuality.
Thanks, Emma. We're going to go to Emma Lewis.
Can you hear me?
Yes, go ahead, Emma.
Okay, yes. I have a question about social distancing. Is this really happening? I get the feeling, well, we don't have any probably hard and fast numbers on this, but I get the feeling that some of us are staying indoors and, you know, doing all the right things, and others are just mixing as usual, say in the markets, in banks, outside offices, on the street, and so on. So how are you concerned about social distancing? Do you think your messages are getting across? Do you think your stay-at-home message is effective? And if not, how do you think you can do better with it?
Well, I think that, like everybody else, we are concerned from the Ministry of Health and Wellness perspective, because we see the pictures as well. People send us the pictures of the crowds in all the different settings. We do know that the message is out there. We know that a lot of persons are conscious of the message and are trying to employ the stay at home and the physical distancing measures. So we do know that there are people who are compliant and are decreasing their risk of exposure. It is, however, our weakest links that make us most vulnerable, because it only takes one good funeral with 1 or 2 infected persons to just start a full, a mini outbreak in one small area, and then it gets mushrooms and gets bigger and bigger. So our concern are really those persons that are not listening, because they are the ones that are really putting the rest of the population at risk. And it is, if these measures are not observed, then we are going to be forced into more severe restrictions that, you know, the entire country is going to have to impose on themselves. So all of those persons in the markets, in the shops, the people who are still gathering for parties, still gathering at bars, we see the pictures, you know, on the roads. All of these persons still need to understand that you are not just putting yourself at risk. You're putting your vulnerable relatives at risk. You're putting my vulnerable relatives at risk. Everybody's vulnerable relatives at risk. You're putting the entire community and the entire country at risk. And if it is that you do not adhere to the measures put in place, then it is really going to force on us all a lot more stringent measures that, you know, is really just going to affect us all in a negative way.
Can I just comment on that, because that is a challenge that occupies the minds of the government, the cabinet, the issue of persons observing the new laws that we have imposed based on the restrictions and the need to distance between each other. In fact, the new terminology I'd prefer to promote now is physical distancing, because we also want to promote social togetherness, but remotely so, digital. I've never had so many Zoom meetings, for example, over the last 2 weeks, 4, 5, 6 a day. And it's not much different after a while than the persons being in the room, because you have the pictures, the sound, and you're able to make the decisions in this very similar manner. That same technology can be applied, of course, to friends and family, where people are now promoting digital drink up and digital parties and digital everything else. I raise it because I appreciate, and I think we should all appreciate, that as a society we are a people whose culture promotes gatherings of one form or another. Indeed, I'd venture to say we are a touchy-feely society. We like to mingle with each other. And to now require those restrictions for persons to stay at home is relatively alien to our culture and makes something used to, and may even affect our mental state. And that is part of the strategy that we are promoting, which is to help Jamaicans to overcome the challenges of restricting movement when they were accustomed to moving around and to going into familiar places. So all of that is very understandable, and I don't think we can just say physical distancing, stay by yourself, without recognizing the downsides or the challenges with coming to terms with that based on our normal culture and our normal activity. Having said that, I think the Chief Medical Officer and indeed the government of Jamaica, in taking the decisions, are linking it to the critical public health risks that we face. If you look at all the viruses that have plagued mankind, the last most severe one when compared to this, 1918, the concept, the principle of separating yourself from major gatherings, the social or physical distancing that we now talk about, has been one of the most consistent ways to contain and to restrict and to minimize the spread. And so we cannot overemphasize it. And indeed, the cabinet has been discussing the issues of markets. Minister Mackenzie, I know, had a meeting today with the mayors of the respective parishes where that was discussed. The Honorable Prime Minister, I know, is leading discussions around additional measures. He was at Coronation Market a few days ago just to see for himself. And there are other typical activities which are part of our culture, and indeed in some instances a necessity for our survival, which in the interest of this public health risk we are going to have to rethink and take some decisions around. And so I urge Jamaicans to recognize the importance, urge Jamaicans to respond to the moral suasion, but also respect the law And if the government have to use the law, we're going to have to do that, because the public health risk is just too great for us to not observe what is being proposed.
Thank you very much, Minister. We're going to try Owen again from Roots.
Yes, good day. Are you hearing me? Yes, are you hearing me?
Yes, go ahead, please.
Okay, thank you. I have a number of questions. I'm starting with the amount of numbers for Kingston and St. Andrew. So Kingston and St. Andrew have, you can say, basically in the lead, basically, when it comes down to cases. Is the ministry looking in any way or checking in any other community and for it to be quarantined, or any special measure for Kingston and St. Andrew? For the mobile field testing unit, it was announced that it should have been Friday, but it's not on Friday. When will the mobile units be up and running? And are there any other community in Clarendon that's being considered for a quarantine?
Well, as it relates to the mobile unit, we're expecting it to the approach to be up and running this week. I'm supposed to go and view the units tomorrow, I think. Hopefully that will be the case. They are retrofitting and they're in the final stages. And that will introduce another approach towards testing, where we will deploy in the field with a protocol and give persons an opportunity to make themselves available for testing. That ties in very nicely with what I announced earlier, which is the online portal, which allows persons to also assess themselves and use that information to also determine on whether they think they need it, at least to present themselves, to allow the clinicians to conclude and administer the sampling if the need arises. So during the course of this week, again, I don't want to second guess the clinicians as it relates to quarantining other areas, except to say generally that this is based on risk assessment. So we don't know what tomorrow will bring. If there are cases that we believe involve spread within the community based on initial contact tracing, then that is very possible. It could happen. We take it one day at a time based on the risk assessment. And so far, I believe we have called it right, the clinicians that is, in terms of the communities that we have quarantined, the Bull Bay 7 and 8 Mile and Corn Peas, Southeast Clarendon. Because as you would have seen from the index case, a number of other cases have been tested positive linked to that index case. And if the quarantine were not put in place of those communities, and by the way, it's still in effect as it relates to Corn Peas, then there's no doubt that those persons who were tested positive and restricted from early could have been spreading unbeknownst to them in other areas among other persons, and that would certainly hasten the community spread that we anticipate, but we work to minimize or to avoid. I don't recall what the third question was, but it sounded more for CMO than for myself. What was it?
The question was basically about Clarendon, if there are any other community in Clarendon.
Well, I think I addressed that. Thank you.
Thanks very much. There's a question from, which we think is a star. It says, with all that is being put in place, is there a time period as to when COVID-19 will no longer be a worry to Jamaica?
Well, you want to, okay.
Yeah. That is very difficult to predict at this time. Unfortunately, the worry for Jamaica is not going to be largely dependent on internal factors. It really is going to be dependent on what is happening outside of Jamaica. The spread in countries that have close relations and large traffic to Jamaica, and the development of treatments that can bring the epidemic to a close. those are the real big factors that are really going to influence when does Jamaica stop being affected. Because we have to recognize that if it is that our borders are closed and we do manage to stamp out any little fires that pop up in and around the country, that once we start opening up back the country, then we are at risk again if those external factors are not managed. So the external factors are really what we really have to be looking at closely, and especially in line of the development of treatments that would be effective in curbing the epidemic.
Can I just offer a little hope? The CMO is a typical, very competent and able clinician, and giving a clinical perspective. As a policymaker, we study clearly and make policy around these issues. And historically, these things operate in cycles. They come, they are novel, meaning new. There is no immunity at first, and therefore they wreak some havoc on the population until modern science catches up, finds the medicine to respond, or the vaccine, or the treatment protocol, and within the time of spread and the response from modern science, they become a normal part of our existence, which generates much less fear with the experience of treatment. So just adding that to what the CMO has said. In other words, we will recover. We will get back to normal living and life without the fear of COVID-19. It may become just similar to the flu because you have it and there's a medication for it. You take it, you don't get into the heightened state of ICU and that. And we have seen the history of that suggests that, with the most significant one being the 1918 Spanish flu and what it did to our society until we caught up. So, you know, if you look around the world, you'll see the trajectory of the spread in different countries, and the curve at some point in some jurisdictions flattening out, meaning having the surge, then looking at coming down. And, you know, I think, well, I know Jamaica will go that route also ultimately. What we're trying to do now is to manage it, manage the impact, lessen the impact on human life and suffering, and delaying, frankly speaking, its spread to give modern science an opportunity to catch up in treatment so that it does not represent the threat that it currently represents as a novel virus.
Thanks, Minister. We have a question from Cassius Watson.
Hi, hey, folks. This is to the CMO. I'm quite curious about those 4 new Kingstonians, let's call them that, who are positive for COVID-19. They say that they're related to someone, obviously, who had the virus before. Are they from a certain geographical area, or are these people just people who maybe have they went out together somewhere or wherever, or are they related in any way?
So these cases were reported today, and I'm just as curious as you are. So our teams are out doing the investigations, and once we get those reports in, then we will make a decision as to the next steps that would need to be taken. So a lot of the investigations are being done today surrounding those cases, as these are just newly confirmed cases. And so I would not want to report prematurely on this, but just to say that as soon as we get the information, then we will decide on the actions to be taken, and the public would be informed.
Thanks, CMO. There's a question from social media asking, are we only getting the cases that need medical intervention? How many are asymptomatic and don't require staying at hospital? Or don't require staying at hospital?
How many confirmed? Okay. The staying at hospital really depends on which part of the outbreak you are in, because initially our aim would have been to take in everybody into hospital, because you're trying to contain as much as possible and to minimize any new cases. But once you start having many imported cases, then as the number of cases increase and the demand for the hospital space is increased, then you would only want to hospitalize those persons that are moderately to severely ill and need to be in a hospital. So we do have to prepare the population now for the fact that as the number of cases increase, then we will start to see that positive cases who are mildly ill and very mildly so in some instances would be treated at home. So the population does have to prepare itself for that. Associated with this, we just want to say that for persons who would be considered isolation at home, these persons would be closely monitored by the public health team, and we would be ensuring that the necessary preparations to isolate that person and to prevent spread to the community are in place. We would not be isolating someone at home if we do not believe that there is the capacity both for monitoring and for persons to maintain the necessary precautions. But we do have to prepare ourselves. At this present time, more than half the cases that we do have in hospital really do not need to be there. They are mild cases. Many of them are asymptomatic now, awaiting the repeating of tests to have 2 consecutive negative tests. So many of the cases that are there really don't need to be there. But in the initial process of the starting of the containment process, this is where we start. As the cases get more and we need the space for moderately to severely ill persons, then those mildly ill persons will be housed within their homes under precautions.
I think it's important to use that last point to make the point about stigma and discrimination. It's very important that Jamaicans recognize that there is going to come a point when most cases have to be treated at home. Indeed, the projections that were first announced on how the virus would populate the country suggests or indicates very definitively that the overwhelming majority of persons who have the virus would have mild symptoms and would recover very quickly with minor treatment, over-the-counter stuff, fluids, rest, and that sort of thing. Just as though you would have the flu and you would go to the pharmacy and get some over-the-counter drug, take it. The doctor would say, get some rest, drink a lot of fluids, and you'd recover. We had projected, or we projected 1 to 1.6 million Jamaicans over a year to get the virus, if the model flows the way we anticipate. We don't have hospital beds to accommodate that number. Of that number, 400,000 we had projected would be seen in the public health system. Just over 2,000 would be serious enough to be hospitalized, and between 300 to 400 would be severe enough to require high dependency or ICU care because of major illnesses, and we identified who the high-risk persons would be for those conditions. So the model really sees a very small minority of Jamaicans needing hospital care, and the vast majority needing just sufficient care that could easily be administered from home. And ultimately, we're going to have to mainstream that, which means that there is no value in discriminating against persons who may have the virus or who have the virus. Where the value lies is to help them to overcome it, because they can get better and can reintegrate in the society, in their community, like any other individual. And we have announced already that we have had, is it 9 or 7 released so far? 8 persons released so far. I met with 3 of those individuals, had a discussion with them. They have not changed in any way, shape, or form, except that they have been through an experience, they have recovered, and they are ready to go back to their normal life. And we would like Jamaica to treat all persons who have had this experience with respect and allow them the opportunity to reintegrate, because stigma can become a significant threat to the course that we're traveling on now. And you may be discriminating against someone today. Tomorrow it actually may be you recovering from the virus. And I'm sure you would not want anyone to discriminate against you. Thank you.
Thank you very much, Minister. I take that as your closing statement.
Not really. I want to reiterate. First of all, I need to conclude by just saying that today is World Health Day, and it would be remiss of me not to say a special big thank you and shout out, if you will, to all our healthcare workers, particularly during this time. The special focus of the World Health Day is nurses and midwives, very important part of our public health fabric. You know, Jamaica has done fairly well in managing this process to date. I take absolutely no credit for it. I think it really resides in the resilience of our public health infrastructure despite limited resources, in the expertise that we have been able to train and the experience that we have had. The primary healthcare workers, the nurses in the field, their support team doing the contact tracing have done an absolutely phenomenal job, and they deserve all the recognition and accolades. So I want to take the World Health Day just to recognize them and just to remind them that we are here to give them support. The government is here to give them support, and we will continue to give that support. Before I ask for that closing video, I just want to remind us again that we have 63 confirmed cases, that today we have spent time establishing critical partnerships to bolster our response. The signing of an MOU with the Medical Association of Jamaica, with the signing of an MOU with Andrews Memorial Hospital, the MOU signing with the University of the West Indies for medical students to man our call centers, the public-private partnership with private doctors to treat critical or chronic diabetics and hypertensive patients to lessen the burden on the public health system, and of course the decision as approved by Cabinet to establish a field hospital at the National Indoor Stadium. All of these decisions have been come out of consultations with the various stakeholders and a recognition that it's all hands on deck to solve this challenge that we face. Everyone counts is the theme, and indeed I'm going to ask us to hashtag the Everyone Counts theme, because we want to make it a standard theme as we confront what is one of the largest public health or most significant public health challenges that we have had in recent memory. I ask you to look at the screen, and thank you again for another opportunity to share an update on COVID-19. Thank you very much. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
C-Sec and Cape lessons here on TVJ.
Please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.